Thanks for joining us. Jan is off. For years now, we've learned a lot about how healthy our communities are by looking at what we flush. Wastewater data has been a big part of understanding whether COVID cases were going up or down, and it was also a big part of our reporting here at KARE 11. Now, with COVID cases on the rise again, that wastewater tracking is undergoing some changes, and researchers are also working to do the same for the seasonal flu and RSV. Today, Kent got an inside look at what's happening behind the scenes and what's in store in the months to come.
Until recently, samples collected from St. Paul's wastewater treatment plant were analyzed on site and used to help track COVID circulating locally. But that stream of information is now streamlined.
This is just wastewater. We've already pasteurized it, so it is safe to work with.
Shannon Champeau is part of a team at the University of Minnesota now working with more than 30 wastewater sites across the state full time
To clean it up and purify and extract the nucleic acid we're looking for.
And though the scientific process for finding and tracking COVID is largely the same, how the public views it has changed. The Met Council published its last dashboard tracker last month, but the University of Minnesota does have a statewide tracker that's getting upgraded this week.
There is more data per region of the state, so people can drill down a little bit more like they could with the Met Council dashboard.
And if you're wondering where things stand in the meantime, Dr. Tim Schacker says the data so far this week keeps heading in one direction.
Wastewater data nationally, including our own data, suggests that this is continuing to increase because wastewater typically predicts 2 weeks ahead of time what's going to happen clinically.
Because the tracking has become so reliable, the university has also been working since last winter to apply the same concept to the seasonal flu and RSV.
We found it. I mean, we could detect it pretty easily. It wasn't at very high levels, but it was also at a time, if you recall, that flu season was a bust. I mean, everybody had COVID, nobody was getting flu.
But now, thanks to a new network with the CDC and the Minnesota Department of Health, they'll soon be able to compare notes with traditional flu and RSV testing methods.
So it's going to take a little bit of time, just like it did with COVID, to learn how levels of that nucleic acid in wastewater correlates to disease activity that we're seeing in our communities.
So essentially, it's got to be circulating a little bit so that you have something to compare it to.
Yeah.
Realistically, how long would it be before there's a dashboard for flu and RSV?
And I can say it won't be long.
I don't know what not long means, if it means a year or not.
I don't think it means a year. I think it means months. And we would really like to have this up and running by the time we get into the heavy flu and RSV season. We're a couple of months away from that, and we want to be ready for it by then if at all possible.
And when it is, it will be thanks to a team that's ready to make it reality.
Having this data can actually help us as a public, as a community, to make smart choices about how we move forward with sickness and disease.
If you would like more information on how to find that U of M wastewater dashboard, you can find the page on our KARE 11 links page or under the story on KARE11.com.